Hello, and welcome to Keynote. I'm your host, Elizabeth Moore. In our February episode, cardiologist Dr. Michael Ghalchi joined us to mark American Heart Month. In this month's Keynote, Dr. Ghalchi breaks down the health numbers you need to know to keep your heart going strong and help you live your healthiest life. One of the things we did want to talk about, which is very important that we emphasize a lot here, is knowing your numbers. So can we just run down a little bit of those? It's basically BMI, cholesterol, blood pressure, and blood sugar. Are there some numbers you should aim for? I know everyone's different, so.
Sure. So I would say blood pressure, you should aim for average blood pressure below 120/80.
Okay.
And when I say average blood pressure, the best way to really assess that is checking your blood pressure at home, checking it regularly. What I tell a lot of my patients is don't even look at the number that day. Just check it every day, and at the end of the month, we'll look at what the average was that month. We'll look at what the trend was. These are the things that really matter most when it comes to blood pressure.
Mm-hmm.
And very often, people check their blood pressure and they see that an individual reading is high, and they think they have to do something about that individual reading, and that's almost never the case. In rare circumstances is that the case. If anything, it's often if that number is low that it can be more of a problem.
Mm-hmm.
But for the most part, when we're talking about long-term heart health, we're talking about average blood pressure. So make sure your average blood pressure is below 120/80.
Okay.
In terms of LDL, for people that haven't gone through a risk assessment, so that they don't know if they have plaque or not, we kind of rely on the general recommendation of LDL less than 100.
Mm-hmm.
For anyone that does have plaque, their LDL should be less than 70. And then anyone that has really more advanced heart disease, the targets are even lower than that.
And do we still talk about good and bad cholesterol?
Yes.
We do.
Yes. So good cholesterol, that's HDL.
Mm-hmm.
So I always have my patients shoot for a target of over 50. And then blood sugar.
Mm-hmm.
So hemoglobin A1C is a blood test that looks at average blood sugar over the course of the prior 2 to 3 months.
Mm-hmm.
And you want that to be below 5.7. So 5.7 for most labs is the cutoff for prediabetes, and 6.5 is the cutoff for diabetes. So we want that number to be less than 5.7.
Okay. And BMI?
So BMI, we don't use very often.
I was going to ask about that. There's been some change of thought about that, right?
Yeah, there's a long answer to this, which has to do with where the fat is in one's body.
Right, waist circumference.
Yes.
Yeah.
Yes. So that's I think a better way to assess.
And are more doctors looking at that, or is BMI falling by the wayside?
I think more and more doctors are looking at waist circumference as opposed to BMI.
Interesting.
But not to say that there's no value to BMI. It's just oftentimes it can be misleading.
It's very rough estimate.
Yes. Yeah, exactly.
Mm-hmm. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.